to help people, change their mindset about health and wellness. And so when people understand that the medication is not fixing the problem, and medication has its place. I do prescribe medication, but yet we think we need medication to make us better. And like I said, medication has its place, but medication is not fixing the underlying problems. And a number of things can be resolved with.
In this video, I sit down with Dr. Gregory Fryer. He is a family practice physician who specializes in functional medicine. So listen in as Dr. Fryer discusses how he takes his patients from sickness to wellness without the use of medications, surgeries, or unnecessary injections.
And it's just really for me to, one, stay connected with people in the community, but also to highlight local business owners that are in the health and fitness industry. And I use this to really educate my current clients, patients, as well as those that I will see in the future. And I really love what you're doing with your wellness program and at your medical facility. And I think it's just definitely something that is worth sharing with people. So yes, I really, again, appreciate your time and look forward to this discussion.
Well, fantastic. Well, thank you for having me. And I actually saw the one that you did with CrossFit interview, and I was like, oh, this is cool. I that's wonderful. I think that's great. And so thank you for having me and thinking about us. And so thank you for what you're doing for the community as well, and making an impact to help people understand to maintain their health in a physical aspect, and not only that, but to stay fit. So, and you're living the example, which is wonderful.
Share with us regarding your background and how you got started.
Great. Well, Dr. Mack, the biggest thing, started in the sixth grade, my passion was to be a physician and to help people get better and do well. And as I went through medical school, after college and everything, I wanted to be a surgeon. I wanted to be a cardiothoracic surgeon. And after I finished my after I did cardiothoracic surgery for, I thought maybe about 50 or something years old, maybe I'd switch over to family medicine, kind of slow things down a little bit. However, God had different intentions for me, and I realized that, hey, family medicine is where I needed to be, and I enjoyed it. But what I was noticing is that more and more people were getting sicker. They were getting on more medications. Things just weren't working out as well. And some people who've been to my presentations before know that as far as my cousin Allison, she died of type 2 diabetes complications. And she was very young. She was athletic when we were little. Didn't really think of that happening to her. But that really made me try to really look at what's going on. So I went to my doctor and I asked them to check a hemoglobin A1C, which measures the last, your average blood sugar over the last 2 to 3 months. And my hemoglobin A1C was 6. And initially, he didn't want to do it because he said my fasting blood sugar was normal. But I'm glad I persisted, because a hemoglobin A1C of 6, that's pre-diabetes. And I'm like, how did I get pre-diabetes? What's going on? I'm exercising. I'm in shape. I feel good. How did I get pre-diabetes? Well, at that point, my beautiful wife, Erin, she told me about functional and integrative medicine. And I went back, got more training in functional integrative medicine. I found out there's some things they did not teach us in medical school. In medical school, in the Western medicine, they tend to focus on disease. They focus on medication, how to prescribe medication for certain diseases. They don't necessarily teach us how to help people get well and healthy. And what I found out going through functional and integrative medicine, through IFM, Institute for Functional Medicine, I realized that I was stressed out. And I realized I was eating a lot of junk. And the junk I was eating was ice cream. That was my body. And I decided to make some changes. I decluttered my life, got my stress level down, stopped working a lot of hours, and I stopped eating all that junk. My hemoglobin A1C got down to 5.5 naturally without medications, and I felt better. I felt stronger, and I'm like, this is wonderful. Why don't we teach people how to do this? And at that point, then I started implementing a wellness program to help people get off medication, because a disease is not a lack of a medication. It's a lack of a certain nutrient or element that the body needs to stay healthy. And with that, we've helped hundreds of people get off medication, reverse type 2 diabetes, high blood pressure, improve their bowel and gut health, stop having high blood pressure, and a number of things. So it has just been fantastic. And so that's what got me started. That's what I'm excited about.
Yes, that's great. That is so wonderful. And I remember hearing that story actually, because the first time I met you in person, I went to that presentation. And for those that don't know, like, I'll just say, like, so Dr. Fryer does I believe you still do these like free workshops throughout the year.
Yes,
at your facility, wellness workshops, just kind of an overview of your wellness program and why it's important for people to learn more about, especially those that have, conditions like type 2 diabetes, like you mentioned, and then some other, hormone imbalances and other things that we see a lot of, but a lot of times it is treated with medications. And I remember, hearing you in that presentation, I was like, this is not typical language that I hear a family practice physician say. Like, it's very common. And I believe I speak for other people as well that say, when we think of our family practice physician or a primary care doc or just physicians in general, we think, okay, they're going to give me prescription medications. They're going to, be these tests, but usually the treatment is either surgery or medication. And there's really no talk about, holistic approach or wellness. And that was just really fascinating for me to hear that from you. And since then I was like, oh yeah, I want to stay connected to this physician because he's speaking a language that I understand and that I completely and totally agree with. And with that being said, I want you you mentioned this a little bit already, but I want you to share a little bit more about your wellness program, what that is, and how is that different than any other experience that most people will go through when they go and see their physician.
Yeah. And just to be all fair and honest, I was trained traditional Western medicine. You go to the doctor, you get a medication, and everything's better. And that's the model. But when I ask people, and what's going on right now? Are people getting healthier? Or are they getting sicker? And 100% say people are getting sicker. I mean, open your eyes, see what's going on. And the thing is, people are getting sicker because they're not understanding the basics. Mm-hmm. Our current medical system, they really, really push acute care. They really push medications, pharmaceutical industry. But more and more providers, more and more doctors, clinicians are coming to the fact that that's not helping our people get better. That's not helping people get better. So yes, I continue to do free presentations. I do free presentations here locally. I usually do it every other week. I'll do a free presentation here in town somewhere. Also, I do webinars, free webinars, because I want to help get the information out to help people, change their mindset about health and wellness. And so when people understand that the medication is not fixing the problem, and medication has its place. I do prescribe medication, but medication is not fixing the chronic problems all the time, most of the time. And when they understand what they need, and you may remember, I'll give the example of the plant, the droopy looking plant, and I say, what does this plant need? And everybody says, oh, it needs water, it needs sunlight, it needs, good dirt or fertilizer. And there's always like, oh, it needs some TLC, some love. And no one has ever said the plant needs a medication to make it better.
Right.
But yet we think we need medication to make us better. And like I said, medication has its place, but medication is not fixing the underlying problems. And a number of things can be resolved with adequate water hydration. Our bodies was meant to move. I mean, our bodies were meant to move, get out, exercise properly. So you're not going to injure yourself, but move and exercise. We need sunlight. We need good nutrition, real food. And a lot of people are eating chemicals that's breaking down their body. And then finally, we need love. So that's, as far as my passion, just help educate the public, the population about there are alternatives in order to stay healthy. Why wait till you have a problem to fix it? If you know that you're going down a road and you don't like where that road is taking you, what would you do? Well, most people would turn around or change direction.
Mm-hmm.
Well, and I ask the question, why aren't you doing it with your health? Maybe we don't know how to do it. Maybe we're doing everything the doctor's telling us. And, I was taught that way as well. Here's the medication. But then as we start opening our eyes and seeing what really is affecting the health of the population, we need to make some changes. And it starts with proper education about our health and people taking personal responsibility to get their health better. And if they're healthy, how they can stay healthy and maintain their health.
You had mentioned earlier in your story about finding out that you were pre-diabetic at the time. You kind of have to push your doctor at the time to kind of give you that test. Do you recommend like people waiting? Because sometimes they hear things like this, like you just said, and it's like, well, that's for older people, or people that are really, really sick, that are on tons of medications. But you also mentioned too, like paying attention to the warning signs. It's kind of a two-part question. So one, do you feel like people that are younger, say in their 20s or 30s, maybe even younger than that, should get some of these tests and measures done to make sure that they're on the right path of health and wellness? And then the second part of the question is, what are some of the other conditions that you have seen, be successful through your wellness program? We mentioned type 2 diabetes, but I kind of want you to kind of touch on some other examples as well.
Oh, yes, Dr. Mack. Well, I will say that understanding your health needs to be taught, and everyone needs to understand, because if you don't have your health, what do you have? And sadly, too many times people wait too late till they start losing their health to when they start, hey, I need to do something about it. And then at that time, many times they're doing the wrong things to help improve their health. So if you're healthy, how can we help you stay healthy? So to the young people, 20s, 30 years of age that may not have any issues, I will say that many times, most times, the issues are ongoing before we start having symptoms. And that's one of the issues with our current health system in America. We wait till there's an issue or a problem before we look to do any changes or intervention. Well, we know that heart disease is usually going on 20 to 40 years before the diagnosis is made. Alzheimer's has been going on 30 to 50 years before a diagnosis is made. Cancer has been going on 15 to 20 years before the diagnosis is made. The problems are ongoing before there's symptoms. So to the people who are healthy and have no symptoms, you want to get tested. One of the tests that we do here now, we do some genetic testing. And with that, we find out, is there any kind of predisposition a person has? And genes, our genetic code, may give us a pathway, but they don't create the destination. And if we know there's an underlying possibility, how can we prevent from turning that gene on in the first place? So getting the proper testing and having the right knowledge in order to act in a wise manner when it comes to your health. Other diseases, other medical issues that we help address. I told you about the irritable bowel syndrome, chronic fatigue. A number of people come to it because they're tired and fatigued, adrenal problems, adrenal insufficiencies, a lot of anxiety and depression going on. And that also could be a contributing, because our bodies, not just our physical body, but our mental and spiritual health as well, factors into our health. So we want to incorporate all of that as a whole. So did I answer your question or did I miss one?
You answered the question perfectly. And I think, again, that's very important for our listeners as well, young or old, no matter what age you are. I think, yes, just understanding your body, your genetics, understanding the path that you're on, and in some cases, changing bad habits. Sometimes we don't know that they're bad habits until, like you said, it's to a point where it's too late. We got a diagnosis, but that's 20, 30, 40 years down the line. And yes, we definitely want to try to prevent that.
And I do want to provide hope. I mean, I tell people all the time, hey, take a deep breath. All right, you're breathing. You're still alive. There's still hope. You're alive. There's still hope. We can make some changes. And when people are ready and they make those changes and they feel better, most of the time they say, I wish I'd done this sooner.
Yes, yes, yes. I saw a video I was reminded to just now. I saw one of your patients posted on his social media, I believe. He was pouring out medications
Yeah.
in a bucket. And I was like, what is he doing? But he was talking about how he was no longer on those medications. You didn't need them anymore because he went through your wellness program. I mean, it wasn't a very long time that he
Actually, it was a little over 4 weeks that he was on blood pressure medication, diabetes medication,
diabetes.
As far as he no longer needed any reflux medication, also allergy medication, all of those things. And we teach people about the 4 basics when it comes to their health. And those things we talked about with that the plant needs: water, exercise and sunlight, adequate nutrition, and love. And we get those things in proper amounts, our body thrives. But when we're lacking in one of those forms, our body starts deteriorating and disease process sets in. So yeah, Michael, he's doing fantastic. Him and his wife, they continue to do well. And that's what we like to enjoy. We call that our medication termination station. So celebration for people no longer needing the medication because their body has now properly healed itself when it comes to that disease process.
Yes. I love that. Dr. Fryer, thank you so much again for this brief interview. And thank you so much for sharing that information, sharing your story, sharing those examples and the things that you are doing here in the community. I really appreciate that. I know a lot of our listeners here in the future are going to find so much value in this. But as we close this out, I want you to please briefly just kind of share with us the best way that someone can find out more about your facility, about your clinic, and about your wellness program.
Okay, they do a number of ways. One, they can give us a call here at 931-221-0902. That's 931-221-0902 at Medical Direct Care. Or they can check us out on the web. Our website is medicaldirectcare.com. That's medicaldirectcare.com. They can check it out on the web. And they can even scan that nice flow code when they're looking at this, and they'll take them right to our website, and they can get in contact with us that way. And we want to be accessible because the information is there, but how can we make sure the information is properly used and applied to the individual? Because our wellness programs are individually based because no 2 people are the same.
And I appreciate your time. Thank you for doing this.
Well, thank you once again for having me. And I appreciate all the things that you're doing in the community. And it's about, every person working together to build the community up. Because when people get better, everything gets better. And there's no need for people to be ignorant. We're all ignorant in some aspects. I mean, I could probably definitely improve my running stride and go to your class. But the biggest thing, once I understand, I need to make sure I'm doing this and having that knowledge, there's no secrets out there. We just want people to be healthy and to do well because, that's what it's all about, helping each other.